Hello everyone, how are you all? Let's continue 2023 pathology paper. 24th question. A 62-year-old woman presents with a hard, irregular, fixed, non-mobile lump in her breast. Her nipple is retracted. Her skin is discolored and her lymph nodes are enlarged. What does it mean if the tumor is luminal A? See, the whole this para is not important, but the last sentence, what it means if the tumor is luminal A, you have to tell which of this combination is referred to luminal A. First, let me show you the answer, then you can guess. Okay, see, this is the molecular based classification for CA breast. It is based on ERPR HER2 new. Okay, first luminal A, luminal B, and HER2 new positive and triple negative. Luminal A refers to ER positive, PR positive, and HER2 new is negative, whereas the proliferation rate, that is Ki67, is low. Luminal A has a best prognosis. Coming to the luminal B, it is also ERPR positive, HER2 positive, that is triple positive. And Ki67, that is proliferation index, is low and hence it is a good prognosis. Whereas HER2 new positive is ERPR negative, but HER2 new is positive. Whereas the proliferation index is from low to high, it has a poor prognosis. Coming to the triple negative, all the three are negative, but the Ki67 is very high, so it rapidly divides. So it has a worst prognosis. Okay, now they have asked luminal A. Can you tell? ERPR positive, whereas HER2 should be negative. High Ki67 or low Ki, it has a best prognosis, isn't it? So it is a low Ki67. So answer is B. Coming to the 25th one, the phlebotomist has been asked to take a sample from a patient for multiple tests. Which of the following order of blood collection for the testing will not contaminate the sample based on the additives present in the collecting tubes? Okay, there will be some of the additives present in the collecting tubes. So when you collect the blood for different tests, you should follow some orders, okay, so that you can avoid the contamination. What is that? First thing you have to draw for blood culture, but here blood culture is a very sterile, isn't it? The sterile thing first we have to draw first, but here the blood culture option is not given. Next, coming to the blue, okay, B blood culture. Next, coming to L, that is light blue, so option A is correct. Okay, next you can remember BLR. Okay, BLR refers to Bengaluru. Okay, BLR. L is for light blue, R is for red. Okay, second option has red. Next comes Y. Here Y is yellow. Sometimes blood culture bottle also will have a yellow color. Okay, first yellow. And you can remember next coming is a Y, that is yellow. BLR Y, Bengaluru Y, green lava G, or you can remember green light go. Green light, if there is a green signal, you will go, right? Green light go. So green is not given in the option. Next is lavender, R is missing here, lavender and gray. Okay, so this is the correct, first option is the correct one. I'll show you. The order is BLR, green lava go, or you can remember green light also, but here you should not confuse L here. Okay, So green lava go is also one of the tune. You can if you tell this one 5 times, you will come. Blood culture, light blue, red. If middle Y can come. Okay, Y is yellow. After red, yellow can come. Then green, then lavender, go. That is gray. Okay, answer is A option. Coming to the 26th one, identify the histopathological image. You can see the red color, isn't it? Red stain. What is this? It is a Congo red stain, which is used in amyloidosis. See, amyloidosis is the word repeatedly we got in this paper, isn't it? So, amyloidosis is very, very important. The stain used is Congo red stain, showing a pink red appearance under normal light due to the deposition of amyloidosis. Whereas elastin fibers will have a Verhoff Van Giessen stain. Okay. Whereas routine HND will have hematoxylin stain which for the nucleus and using for extracellular. Collagen uses a Manson trichome strain, okay, where all in the pathology you can see the Manson. Please comment, okay? Okay, answer is C, Congo red stain. Coming to the 27th one, which of the following are the features of necrosis? This is necrosis, apoptosis, very, very important question. Necrosis is a physiological or pathological? It is a pathological, isn't it? Apoptosis can be physiological, but necrosis is always pathological. So option 4 is wrong. So 4 is ruled out. Only one option is present. See here. Yes, B. So it's easy, right? Let's see. Disrupted cell membrane will be present in the necrosis. Yes. Induces inflammation. Yes. Swelling of the cells will be present. Yes. So all the three, 1, 2, 3 are correct. Only fourth one is wrong. So if you know the definition, there only you can rule out. See, necrosis is an enzymatic ischemic process. It is a passive process, whereas apoptosis is an active process. The death of group of cells will be there, always pathological. Cell size increases, cell membranes are get affected, inflammation is present. Whereas the phage, one electrophoresis will be there. Okay, that is polyacrylamide gel electrophoresis. It will be in necrosis, it will show a smear pattern, whereas in the apoptosis, it will show step ladder pattern. This is also a question. The step ladder pattern is also a question. Why in the necrosis there is no step ladder pattern? Because the endonuclease is absent. So there is no one to break the molecule. Okay. So there is the pattern will be smear like, not step ladder. Okay. So 27th also done. Coming to the 28th one, which of the following is not essential in work of mosaic Turner syndrome? Anti-nuclear antibody is required. Is it required in Turner's? Let's see the second one. Glucose tolerance test. Yes, Turner's will be more prone for diabetics, so glucose tolerance test can be done. Audiometry, yes, there is a hearing problem, so audiometry is useful. Echocardiography, yes, because the congenital heart defects will be present with Turner syndrome, like coarctation of aorta. So anti-nuclear antibody, until we suspect some autoimmune diseases, it's not necessary. So option A is not done. Okay. See the yes, to see the glucose tolerance in diabetes internals, we need glucose tolerance test. Audiometry, yes, required. Echocardiography also, yes. Coarctation of aorta, bicuspid aortic wall also will be more common in Turner syndrome. So this all are required, but ANA is not required because until you suspect some associated autoimmune disorder. Okay, coming to the 29th one, match the following genetic disorder with their inheritance pattern. Yes, cystic fibrosis, labor optic neuropathy, muscular dystrophy, myotonic dystrophy. See, all the genetic disorders we will discuss in the 20th book, but first let's at least make sure these four we will not make a mistake. Okay, first thing, cystic fibrosis. Something cystic fibrosis we have learned many times. Cystic fibrosis also very very important, but you can remember this is recessive. Fibrosis is recessive. A is 2. A is 2. Only two options as a A2. Okay. Leber optic neuropathy is something related to mitochondria. So it is a mitochondrial inheritance. So B is 4. Okay, all the option contains B4. That is, we are lucky. That is, sometimes this we might tend to forget, isn't it? So, but the option contains all B4. So we no need to think about B4. Okay, now let's see. Duchenne muscular dystrophy is something. It is a X-linked recessive. The males are getting affected. So C is 3. So C3, 2 are there. That is A and C. Myotonic dystrophy is the autosomal dominant disorder. So it is dangerous, isn't it? Yes. D is 1. See, cystic fibrosis, autosomal recessive, Leber optic neuropathy is mitochondrial disease, Duchenne muscular dystrophy is X-linked recessive. The males are getting more affected. If something in the question, the male with some muscular problems, you can suspect Duchenne muscular dystrophy. Okay, this is also very very important question even in the physiology. Okay. Myotonic dystrophica, it's a autosomal dominant. So option is A. Okay.